Facelifts are booming. Some surgeons are making over $300,000 off of a single facelift surgery. 4 years into private practice with a full waitlist, I walked away. Today I'm going to tell you the story of why. And at the end, I'll answer the question that everyone asks me. Do I regret it? I waited a few years to make this video because I wasn't quite sure how it would be perceived, so please be kind in the comment section, and I hope that you find it interesting and insightful. I'm Dr. Gary Linkov, a facial plastic surgeon. These days, I focus exclusively on hair surgery and lip surgery. Let's get into it. It was the fall of 2022. The Zoom boom was still echoing. People were more excited than ever about facial aesthetics. There were new technologies on the market. Old surgical techniques were getting revamped and modernized for more natural results. My clinic was busy. Our YouTube channel was growing at a rapid pace, and consultations were booked months out. On paper, it looked perfect. But inside the practice, my weeks were split. 2 weeks of facial plastics, and then 2 weeks of hair, and then it would repeat. And my team, they loved hair weeks. The room felt lighter, faster, and more in flow. And here's the truth that I didn't want to say out loud at that time. I did too. I'm going to share with you a composite story, a blend of moments from a stretch of cases that made me pay attention. 7 days before a facelift, I get quiet. I'm meticulous by nature, slow, careful, precise. And facelifts demand that. They're long procedures, and they have real, not just theoretical, risks, like bleeding, facial nerve injury, and skin healing issues. My patients did very well, but I started to feel it. The anticipation creeps in early. The night before, I'm rehearsing every move in my head. The morning of, I'm calm, but my tank is already half used. The case goes smoothly, we finish, and the patient's in recovery, doing well. I go home, and for the next 48 hours, I'm replaying every single step in my mind. Did I release enough of the facial ligaments? Was the pulling vector just right? And how's the flap perfusion going to look the next morning? Meanwhile, hair weeks feel different. It's thousands of micro punctures, artistic decisions that add up to framing the face. My team is in sync. There's joy in the room, and the anxiety profile is just lower. And around that time, a consultant told me something that a senior surgeon once told her. He said, I stopped doing facelifts after 25 years, and I've never felt better. I wish I'd done it sooner, he said. And that sentence, it lodged in my brain, and I couldn't unhear it. Mastery requires focus. To be world-class at anything, volume and immersion are extremely important. I could no longer be two different surgeons on alternating weeks. If I wanted to be considered one of the best in the world at a certain procedure, I realized that I had to pick a lane or two and own it. I couldn't be the best at every one of these procedures because there was just no time to do these surgeries all week long. Finding a calling through lived experience. My own journey with alopecia areata changed me. Hair was not just technical for me, it became personal. And that showed up in consultations, in the OR, and during follow-ups. It felt like a calling, not just another category of procedure. The anxiety tax. Facelifts consumed me before and after each case. I could never accept doing a mediocre job, so I always pushed to perform facelift surgery at the highest possible level. I was present with patients, but I wasn't as present at home. My staff felt it too. I just wasn't as pleasant to be around on facelift weeks. If excellence costs you the rest of your life, at some point that math stops working. I knew that the financial potential was tremendous, but for me at some point it just wasn't worth it. Ethics and timing. Already in 2022, I saw a trend towards facelifts being performed earlier and earlier. But I believe that facelifts should treat true facial aging, not the first hint of laxity in our 20s. Remember that more surgeries over a lifetime means more cumulative risk. And that just didn't align with my values. I found myself saying no to more and more patients asking for facelift surgery when they were just too young. Respect for the giants. There are surgeons pushing modern facelift results to incredible heights. I even trained with some of them, and I very much respect their work. But I realized at some point that I don't have to be them to contribute meaningfully to the greater field of plastic surgery. And hair and lip surgery were evolving quickly. I felt that I could lead and innovate there. I decided to trade breadth for depth in order to gain clarity and expertise, artistry and flow. Both facelift surgery and hair transplants demand much skill, but they are different in some important ways. To me, hair surgery is about composition, hairline geometry, density gradients, curl and caliber, exit angles, and temple flow. Like thousands of micro brushstrokes that help frame the face. Facelifts, to me, feel a bit more like engineering. Planes and vectoring, flap perfusion, hemostasis, and precise tension management. There are more technical decisions with higher stakes. I sometimes felt like I was navigating around some landmines, and instead of enjoying the process, I was more worried about some of the complications that could come about with any misstep. And I realized that I'm the happiest in the composition, where millimeter decisions become a portrait. And in addition to the artistry that's required for hair transplant surgery done properly, it has the power to deliver the same level of confidence boost to someone as a facelift does. So in late 2022, I stopped offering facelifts. I focused fully on hair and lip surgery, and I continue to do the same. Since then, we've done thousands of procedures. Patients fly in from all around the world. But the real change? My team is energized, and I love the work. I still continue to cheer for modern facelift surgery. The field has really made tremendous strides, and we have some amazing leaders in that field. And I published a video recently on what makes modern facelift surgery so special. So if you haven't seen it already, please make sure to check it out. So, do I regret walking away from an in-demand, high-revenue surgery? No. The best outcomes happen when a surgeon's skill, values, and joy overlap. And that's where I operate now. Some ask if I'll ever return to doing facelifts. Never say never, but right now I'm exactly where I should be. Thank you so much for allowing me to be vulnerable here with you today. And if you haven't already, please make sure to check out our GQ award-winning hair care products at feelconfident.com.